Psych NP. I'm going to start a new topic segment called Psych NP Talks every Friday, and I'm going to talk about certain medications that I like to prescribe, give you guys a little more information on when I prescribe it, why I prescribe it, the concerns when prescribing it, and just little things that I've learned from my practice and the efficacy that I've seen when prescribing it. So guys, every Friday it will be a new medication, and today we're going to be talking about Escitalopram, otherwise known as Lexapro. Let's get to it. Alright guys, so Escitalopram, dosing related, it goes from 5 to 20 milligrams. That's the recommended maximum dose is 20. Most people respond to 10 milligrams, 15, 20, but in some cases you can even try 30 milligrams. I have a couple of my patients on 30. There was a study that went up to 50 milligrams. The problem is that it's not very well tolerated above 30. I've generally prescribed from 20 to 30 milligrams as my maximum dose. Especially if someone has like an OCD or a generalized anxiety disorder, that's when I'll start to try 30. For the depressive, phases, 20 milligrams is, will suffice. The one thing, guys, is that it's one of my favorite SSRIs to prescribe. It's one of the most selective SSRIs. It doesn't have many drug-to-drug interactions, if any. It's very well tolerated. The half-life is 27 to 32 hours, very similar to a lot of the other antidepressants in this drug class, other than Paxil, which is a very fast half-life, and Prozac, which is a very long half-life. It doesn't have any affinity affecting any of these other receptors. And for me, the most side effects that I've seen, I see the nausea, I've definitely seen the stomach upset, some weight gain, very minimal, but I've seen weight gain for sure. Headaches, increased sweating, sometimes sexual dysfunction. The thing is, people ask, who is the ideal patient to start Lexapro on? Generally, it's someone that has never been on any medication before, and they're experiencing some depression or some anxiety. Lexapro is always my first line. It's my favorite medication. I've seen really high efficacy. It's very well tolerated. That's a big thing with patients. You want to not have any of these side effects if you want to try to take a medication. And efficacy-wise, it's worked for a lot of my patients for depression and anxiety. What dose would I start them on? I start pretty quick. I start at 10 milligrams. Depending, if there's someone that's never been on, maybe I'll start at 5 milligrams. Initially these 3 to 5 days when you've never been on an antidepressant, or even if you've been on an antidepressant before, these 3 to 5 days initially, sometimes you have these GI side effects. A lot of serotonin is in your stomach and in your gut. That's why you get a lot of these like nausea, stomach upset, things like that. So you have to be very careful. But you have to let them know that it's normal to get stomach upset, some headaches, some nausea. And generally in 3 to 5 days, I would say at least 80% of these patients these symptoms will reside or will resolve. But if they keep going, then you might need to look into a new medication and try it. There's so many other antidepressants to try, and maybe it's better tolerated for that patient. It's different for everybody. Now, if they're having a sexual side effect, that's a little bit different. Generally, even if you wait a couple months, it doesn't really change. So let's say they're having trouble. It can also be dose related or time related. So if a patient is having trouble having sex and they like to do it at night or something like that, you can dose it after they do it, because generally that will help with a lot of the sexual dysfunction. Also, you can add Wellbutrin SR 1 to 2 hours prior to any sexual engagement, and that can also help boost some of the things that they're dealing with sexual dysfunction. There's many things, and let's say these two things don't work. You dose it after, then you most likely need to try new medication, especially if it's affecting their quality of life. If they can tolerate it and it's not a problem in their life, then that's fine. They can deal with it. But if it's a problem, then in that case, you should try to find another medication. But for me overall, Escitalopram is probably one of my favorite medications to prescribe. I've seen it work for a lot of my patients. It doesn't work for everybody, guys, but for the most part, it's well tolerated, has proven to have high efficacy, and it's a medication that should be in your toolbox. All right, guys, the Psych NP out.